Hi, this is Julie Lubinsky. I'm Web Manager for the Christopher and Dana Reeve Foundation, and I'd like to welcome you all to this month's edition of Ask Nurse Linda. Nurse Linda, she's been a leader and a provider of rehabilitation nursing for over 30 years and a friend of the Christopher and Dana Reeve Foundation for close to 20. She's a moderator in our Ask a Nurse discussion on our online community, where she focuses on contributing functional advice, providing the how-to, and integrating various healthcare improvements into daily life and answering your questions. And once a month, we are so grateful to have her here live and doing this a live web chat with you. So now I will turn it over to Linda. Hi, Linda.
Hello, good afternoon, and welcome everyone. It's so nice to be with you today. We're coming to the end of the year, so I thought this might be a good time to talk about dietary needs, issues that come up with eating. You know, it's the holiday season, and it does not matter if you have paralysis or if you do not have paralysis. People enjoy the foods and the fluids and the flavors of the season. And so it is always a good reminder to start thinking about your diet. It's always a good time to think about diet just in general anyway, because it's so important. If you have any kind of chronic illness or disease, it's just critical that you keep your body healthy as it can be, and that helps with all kinds of different activities and processes that go on in the body. So establishing a great nutrition plan is a very important thing to do. Not very many of the people in the United States especially, but in the world have all in all that much of a good nutrition. People tend to eat what they like, and they tend to not eat what they don't like. And what they do like, people tend to eat way too much of. In the United States in particular, I know we have a lot of listeners from other countries, and so for you, you are very fortunate. In the United States, we suffer from something called portion size overload. So when we go out to restaurants or go to other people's houses or have meals, we don't really have a good sense of how much we should be eating. We have oversized plates. We have, when you go to a restaurant, sometimes they bring out food to one person that is literally a platter size that in most places 6 or 8 people would consume that amount of food. And this is no exaggeration. Anybody who's been to some of our restaurants here in the United States, they bring these huge heaping platters of food. And so we kind of have a distortion about that and the portion sizes that we should eat, and not only that, but what we should be eating. There's a lot of information that's available on the web that's very helpful, a little bit that's not so much helpful, but there's a lot of information about eating a balanced diet. Unless you have some kind of medical problem or you're taking a particular medication or you have something that's going on, most people just need to follow a regular balanced diet. And there is, you can go on the web to some government sites which have some very good information about providing yourself with a balanced diet. We'll give you ideas about recipes, give you ideas about portion sizes, and give you ideas about how much you should be eating through the day. Variation is always a good thing in your diet. Some people use simple kinds of ideas like, be sure you have a lot of different colored foods on your plate because that generally represents a variety of food groups. There is a website put out by the United States government called myplate.gov. And this is a very nice website. Actually, it's called Choose My Plate. So the site is HTTPS, so it's a secure site, https://www.choosemyplate.gov. And so that gives you a very good visual of how your portion sizes should be. There's also an overall dietary plan for people to use, it's called the food pyramid, which gives you an idea of the amounts of food that should be eaten, proportions of food, and it also combines with exercise. So sometimes people think that they have paralysis, they cannot exercise, but there are all kinds of things that you can do, and we'll get into that in a little bit later. I did want to mention just the importance of getting good basic nutrition is important for your body function. So having all the nutrients and vitamins and getting your body up to optimal function, especially if you have paralysis, this is going to be critical for you because not only does nutrition affect how you feel, just your general mood, so good nutrition puts people in a healthier status. A healthier status makes you feel better. Having good nutrition makes your body function better so that all those nutrients are being broken down on microscopic levels and entering the cells and fueling your whole body as opposed to just quickly passing through or eating foods that you have enough of those particular nutrients so they're just being eliminated from your body or building up to toxic amounts. A lot of people will ask questions about dietary supplements. In the United States, we are very keen on dietary supplements. They are advertised to us on TV all the time. It's in magazines. It just surrounds us all the time. There are a lot of people who have studied dietary supplements and they're like, oh yes, you should be taking this particular thing, this particular nutrient for sleep, and this particular nutrient for something else. We have special nutrients for making our hair shiny and our fingernails growing better. So there's just a nutrient for everything. But if you're eating a well-balanced, healthy diet, a well-balanced is a healthy diet, you probably really don't need any of those nutrients unless you have some condition going on in your body that would require it. Or sometimes people take some of these nutrients as they are prescribed by their friends who've read a lot about it, but they don't realize that the person taking the nutrients maybe is on a medication that counteracts with that particular nutrient, or there could be some kind of other problem. So the take-home message for today is if you feel like you want to try some different vitamins or nutrients, be sure and talk to your healthcare professional to make sure that you're not taking something that's counteracting with some medication that you are already taking for another purpose. I like to use the example of people who take the blood thinner Coumadin. The generic name is warfarin. It's a blood thinner given to a lot of people who have cardiac problems for thinning the blood just in general. It can be given for a variety of reasons. Sometimes people take it after a very traumatic accident, so you might be on that particular medication. If you take that particular medication, it's contraindicated to eat salads. Now, if you're following a healthy diet, you think, oh good, a salad, that would be very healthy for me to eat. But that counteracts this one particular medication. There are other heart medications that if you read the label on the bottle, it'll particularly say, do not take this medication with grapefruit juice. A lot of cardiac medicines have that contraindication. Certainly not all of them. That includes grapefruit juice as well as grapefruit itself. So you have to be very aware when you're ingesting anything into your body how that is going to affect the other parts of your life and what's going on with your body and the needs that you have. So it's always a good idea to talk to someone. Now, medications and supplements do not always come in pill form. Sometimes there are what we call topicals or ointments or lotions that are rubbed on the skin. A lot of hormonal treatments come in this kind of form. Sometimes people will wear a patch for blood pressure and it has some medication in for to control blood pressure. There is actually a drug that people don't think of it as a drug, but it is a drug. It's very popular for people to get Rogaine, rub it on their scalp to improve their hair if they're suffering some baldness problems or some thinning of the hair. So people will use Rogaine, rub it into their hair. Rogaine was originally developed, under a different name. It was originally developed as a blood pressure medication that you would take by pill. But what happened in the testing of this blood pressure medication, what happened was people started growing hair on weird places of their body. And so what they did was they changed it from a blood pressure medication. You can still get the original drug. Some people will be taking it for their blood pressure. But now it's really marketed more and used more for growing of hair. So if you have blood pressure problems, or if you have low blood pressure problems and you're rubbing a lot of Rogaine into your scalp, that's seeping into the pores of your skin, and so that can affect your blood pressure. So as I say, there's just way too many vitamins, supplements, nutrients, foods, lotions, and to really go through all of them and say, well, you should be taking this or you shouldn't be taking that. So it's just best for somebody to look at your individual health care needs and see what's really best for you to use if you feel like you need to use a supplement of some sort. So there's all kinds of things to do with that, but basically if you follow a good diet, you will have good nutrition. People will look at their diet, especially if they are overweight. Maybe they would like to lose some weight, so they'll cut back on some of their calories. People also look at their diet if they're underweight. A lot of people with paralysis, especially with those lower injuries that have the muscle wasting because their injuries at a lower level, and so it's really hard to build up muscle in the lower extremities. Sometimes you see people with lower level injuries and their legs just seem to get smaller and smaller. Almost every day they just keep getting smaller because they have that lower motor neuron injury. Either being underweight or being overweight can affect you when you have paralysis, because what you need to do to have for pressure ulcer prevention is to have muscle underneath your bony prominences, so where those bones are sticking out and are closer to the skin. Being underweight, those bones can, just drill right through the skin because there's nothing there to protect them. Being overweight can affect in the same way, but through a different mechanism, in that fat does not have that pressure dispersing mechanism. So if you're sitting on a lot of fat, people will joke, I won't have a pressure sore because I'm sitting on a lot of cushion, referring to the fat. But actually fat does not disperse that pressure. So when you're sitting on fat, you're just adding more and more pressure from where those bones are sticking out. So having a good nutrition and developing good muscle tone, getting your muscles up to speed is a great thing to help prevent that. It's also a lot easier to move yourself if you're not that weighted down heavily with a lot of extra weight. So those are some things to just think about in general, but nutrition is going to affect our whole internal function of our bodies. It's going to affect the cells of our bodies. It's going to do everything from helping maintain our skin and our muscles to maintaining good eye function, and even that if you want that shiny gloss on your hair, you can certainly get that through good nutrition. So we have some questions today, so let's go ahead and start the questions. The first question, the one that's near to my heart, is what types of food are best to add to my diet to keep bowel program regular? Certainly what goes in your body has to come out of your body. We all know that. And people are always concerned about their bowel program because after paralysis, or just even with general limited mobility for any particular reason, it could even be that you work in an office all day long and sit at a desk and don't get up and aren't able to get up and walk around a lot. So not having that movement in your abdomen and the motion of moving around certainly affects the regularity of your bowels. So what we know is that fiber will help regulate a bowel program. Now sometimes people just can't get enough fiber after paralysis to really get those bowels regulated, so they might have to take a fiber supplement. So sometimes they'll take powder that's dissolved in water. You can get fiber cookies. You can take fiber tablets. The key to fiber is, though, whenever you put any fiber into your body, you want to be sure and drink a lot of fluid after you've taken that fiber. You don't want, if you take a fiber tablet or the fiber powder, you don't want to get that clogged up in your bowels, creating an obstruction there. So drinking a lot of fluid with that is important. I see a lot of people taking the fiber powder, and they'll take it with a little tiny glass of water. That is not going to be enough. If you read on the bottle, they will say take with a full glass of water, meaning 6 to 8 ounces of water to help push that fiber through so it doesn't get clogged in there. So that's really the best. If you look at foods that contain fiber, it's anything that has roughage to it. So if you're going to eat some grain, so if you're eating bread, be sure you eat whole grain bread. Read those labels and see how much fiber is in anything that you eat. Fresh fruits and vegetables, especially fresh vegetables, will help add fiber to your diet. Look at the packaging to see how much fiber is in those particular items that you're eating, and then eat just normal portions. Look at the serving size, so that will give you an idea of what a normal portion would be, and then choose my plate. So sometimes in packaging, much like any other kind of advertising, sometimes they'll want to be able to say this is a low calorie or a lower calorie kind of item. So the serving that they suggest is a half a serving. Well, if you need a full cup of broccoli to hit your fiber for that particular meal, and the package says half a cup, then you know you need to double that, which means you're doubling the calories, you're doubling the fiber that's on the package, you're doubling any carbohydrate that's in there, you're doubling any nutritional value that's in there. But still, stick with the My Plate as opposed to the packaging, because that has a lot of advertisement to it. There's a lot of hype about low-fat foods, and dieters like to stick to those low-fat foods. But sometimes, again, you have to look at the packaging. Sometimes the low-fat is substituted by an increased amount of sugar. So sometimes buying the lower calorie or the lower fat food is not always your best option. When you go to the store and go shopping, one of the best things to do, and it makes a lot of sense, but it sounds kind of wacky. When you go shopping, one of the best things to do is just shop around the outside perimeter of the store. That's where all the refrigerated items are going to be. That's where all the fresh items are going to be. So if you can, just shop around the perimeter of the store. If you think about a grocery store, you go in and the first thing you have is the fresh fruits and vegetables. Again, it's in the refrigerated cases around the edge of the store. The meat being fresh is in the bunkers, usually in the back. And then the dairy products, the fresh dairy products, are along the sidewall of the store. And the reason why that is because it's expensive to put refrigeration into the middle of the store. It's much cheaper to refrigerate just along the edges of the store, because that doesn't take as much mechanical power to get those refrigerators and the connecting tubes and all the pipes that go to that. So if you just shop around the edges of the store, you're gonna come up with a pretty good diet of a lot of fresh items that are going to be healthy items. When you get into the center of the store, those aisles that you go up and down, you'll notice that you're looking at a lot of canned goods, which probably contain a lot of salt. You can buy canned goods with low sodium if you like that option. You'll find a lot of packaged foods. That's where the cookies are. That's where the alcohol and wine is. It's all right in the center of the store. Those snack food items, center of the store. So if you stay on the outside rim, you're going to be doing a lot better with your diet than going into the center of the store. The next question is what's the best method to strengthen the core and urination control? Well, strengthening the core is a very tricky proposition for individuals with paralysis, depending on the level of the paralysis. And this is a question that we have all the time. People talk about their little tummy bulge and they want to get rid of that. And if you don't have muscle functioning, it can be difficult to do. However, you still can exercise those muscles simply by doing your wheelchair push-ups, bending your body forward and pulling your body back, bending from side to side. That is certainly going to strengthen your core. So if you imagine you're sitting in your, I'm imagining that I'm sitting in my wheelchair. I'm sitting in a chair, but I was imagining that I was sitting in a wheelchair. I would just think about taking my right arm and just hanging it over the right side of the chair and leaning over as far as of my armrest as far as possible. If you don't have an armrest, you're going to have to be very careful that you don't lean right out of your chair. You should be careful with all wheelchair exercises to make sure. Then you can lean to the left. You can lean forward. Now, something that you cannot do in your chair, because there's usually a back there, is you can't lean back. But leaning back will also stretch the muscles of the abdomen, which will, keep them from getting too short from sitting all the time or just from laying all the time. So when you transfer onto your bed, if you want to lean back and use your arms for support and lean back to stretch your muscles, remember muscles go, they balance each other. So you have muscles in the front and you have muscles in your back. So be sure and stretch all of those muscles all directions. When you think about, kind of as a side note here, when you think about stretching your shoulder, people will stretch their arm forward, they'll stretch their arm to the side, they'll stretch up and down, but they'll forget to draw their arm, their elbow back towards their back to strengthen those muscles also. So same thing in the abdomen. Now there are some exercises that you can do if you're into any of the functional electrical stimulation. That will certainly strengthen your core muscles. If you have any kind of sensation or ability of the muscles in the urinary system, being able to do the Kegel exercises certainly helps with urinary control. A lot of people don't have that ability, and so that can become frustrating. But if you have that ability of stretching those muscles and exercising the muscles, doing the Kegel exercises. Now, while you're doing that, think in your head about what you're doing and trying to make those brain-body connections as you're going along. Visualizing what you're doing and thinking about what you're doing helps that brain remap to try to reorganize itself to be able to deal with that process. The next question is, what tools can help a person with limited mobility prepare their meals? And I love this question because if you go online and look up tools or items for people who have mobility challenges, if you look up a medical supply catalog, you will just see all kinds of tools there to help you do things. So one of the basic tools is, if you have limited hand function, is to get a universal grip, which is a Velcroed item that you can put around your hand, and then you can stick a spoon or even a knife into that. So if you have some arm function but not that grip strength, you can be able to cut some items, you can stir things. You can also put a pen in the universal grip if you want to try to write something. You can put a brush or comb in the universal grip. You can put a razor in there. So there's all kinds of things. I have had some really highly motivated teenage girls who've put their mascara in the universal cuff and are able to apply their makeup using that. So if you don't have a universal cuff and you have limited hand function, that's probably something that you want to talk to your payer. That's going to be a key piece of equipment that's going to increase your function. That's going to be a very important thing. Now, if you look at these items in the medical supply catalogs, You'll find they're very expensive. You'll find that oftentimes, or at least sometimes, your payer does not pay for these, or they'll pay in limited amounts. So look at those items and think, how maybe could I make one of those items myself? People who use built-up silverware, or if you need to stir a pan but the handle is too small, you need a little bit more built up around that handle to really grip it and to be able to stir. You can go to the hardware store and just buy a piece of foam tubing and stick it on there. And that is just, it's like pennies compared to the cost of the equipment. Some other things that you might want to do is think about if you're in your chair and you're moving hot or cold items from place to place. You don't want to have that sitting directly on your lap because that heat's going to burn your skin. The cold is going to be freezing to your skin and do damage with frostbite. So always put hot or cold items on a nice thick board if you have a thick wooden cutting board. Even better is a nice thick wooden tray that has some sides on it, so in case something spills, it goes on the tray and not on you and not on the floor that you later have to clean up. If you don't have a cutting board with handles on it, you could go ahead and put the cutting board on a cookie cutter tray. A lot of people use those, but remember they are metal and they will conduct heat. That's the purpose of those items. So be very, very cautious if you use anything metal that you're going to be putting on your lap. Be sure a towel is not going to be probably enough. Something wood that hot or extreme cold is not going to be able to penetrate in the time that you move an item from spot to spot. Another handy thing is to have a stove with the knobs or the dials on the front of the stove so that you don't have to reach over the hot burner to turn off and turn on the stove. There are other things that you can do. You can get for really inexpensive at the cooking store, or even the big box stores, the Walmart or Target, or whatever store you have locally. You can get an oven rack push puller, which is a wooden device. It's not too expensive, but you can hook it on the rack of the oven to pull it out, so that leaves your hands a little more free to be able to deal with the food in the oven. And then there's the other end of it pushes the rack back in the oven. So there's a variety of tools and instruments. If you have trouble cutting things, there are rocker knives that you can get where instead of slicing with making a motion going back and forth, the knife rocks back and forth to cut things. There's just all kinds of equipment. There's dishes that you can use, plates that have a built-up side, so if you have trouble getting your food up onto your fork, instead of chasing it around the plate, you can go up against this rim and kind of capture your food as you go along. So there's just all kinds of things. Be sure and look and take advantage of the Internet. Everybody listening is listening over the Internet. So be sure and look at different items to see what there is, and then think of ways if you could possibly make that particular item for a much less price at home. The next question is, are there any foods or groups of foods people should be wary of or limit their intake? Well, now this is a very interesting question also. Boy, we're just loaded with them today, aren't we? This is the thing. When a person is not moving, when you have mobility problems, so if you have issues with moving your legs, especially the long muscles in the legs, that's where a lot of our sugar metabolism takes place. Now, it takes place all throughout our body, and sugar is metabolized in the internal organs of our bodies, but it's dispersed out through our bodies. And so when it gets to especially big muscles, it's good to have some movement in there because that helps metabolize sugar and it helps metabolize carbohydrate. So the incidence of diabetes is much higher in individuals with mobility problems than it is with individuals in the general population. And individuals in the general population are having higher and higher and higher incidences of adult onset diabetes because of this high sugar, high carbohydrate intake that we have in our diet, and because we're more sedentary. So sometimes people are able to move around, but they just don't, because either they don't prefer to exercise, or they just have a job where they have to spend long periods seated, and so they're just not able to get up and move around. But the more you're able to move your legs, even if you're able to passively move your legs, the more risk you're reducing in your chance of developing adult onset diabetes. So even if you can't move your legs, if you do passive range of motion, that's going to help exercise these huge muscles that are in our thighs. That's where our biggest muscles are, and so that's going to help. By eliminating that belly fat, we all hear about the belly fat all the time, so doing our exercises to help reduce the belly fat is also going to help. And then also the food groups particular to be wary of is to really limit your take of refined sugars, which are found not only in doughy foods, white foods, cookies, candy, but also in soda, in sports drinks. There's sugar hidden in lots and lots of things. People consume a lot more sugar than they realize. So that's why I always say stick with water. You know that that's going to be, not have anything extra in it that like sugared items or caffeine that's going to work against you. The other thing is looking at those carbohydrates, because that is such a key factor also in the adult onset of diabetes. So really looking at those kinds of things and really being wary of what you're taking in, looking at the My Plate so you're not, eating vegetables is great, but a solid diet of vegetables is not going to give you your full nutritional intake that you need. You need to have a variety of foods. Another thing that I mentioned earlier was the caffeine. Caffeine does a lot of weird things to our bodies. It certainly affects our bladder and how it functions. If you talk to somebody and they say, "Oh, I'm having a soda or a diet soda," or even caffeine is hidden in a lot of foods, coffee, tea. It's pretty prevalent there, but it's hidden in chocolate and it's hidden in a lot of foods. So there's a lot of foods that have caffeine, and we drink caffeine, and whoops, that really affects bladder timing and catheterization. So there's all kinds of different things in our diet that can affect what we're eating. The person asked before about regulating their bowels and what they should be eating. People know what affects their bowels, and from maybe pre-injury or pre-illness, they might know, I need to kind of stay away from some particular kinds of foods, such as beans might speed up the bowels, or might cause a lot of gas, foods that cause a lot of gas. So people will kind of avoid those foods. So if that bothered you before, maybe that would bother you now. So if some food group really bothered you, if you were lactose intolerant, some people are lactose intolerant and don't really even realize it, but they might have milk or some other kind of dairy lactose-containing product, ice cream or cottage cheese, any kind of cheese or yogurt, and they might find that shortly thereafter they have to have a bowel movement. So if that happened to you before, it's kind of a good idea to know, maybe you weren't diagnosed as lactose intolerant, but maybe you were kind of headed down that direction. So always think about what bothered you before is probably not what you want to do now. Now, some people will use that to their advantage. So if you're a person who enjoys beans and you know that that could affect your bowel program, they might choose to eat their beans before they have their bowel program because they know that's going to speed up their bowel movements. Now, that can be kind of dangerous because if you had problems with that before and you don't have control over when you want to empty your bowels, that can still run into problems. But sometimes people are pretty savvy in knowing, it's bowel program day. I think I'll have a little of this particular substance today, and that will help them. Okay, so the next question is, how does bad eating habits and obesity affect people living with paralysis? Well, it affects people in a variety of ways, one of which is just a lot more difficult to transfer a heavy body than it is to transfer normal weight size body. So if you are extremely obese, it's a lot, you might not be able to independently transfer. You might have to rely on a lift. Some people rely on lifts because they don't have the function to do it independent, and that's okay. But if you can transfer yourself on your own, it's a lot better for, using your muscles of your body instead of remaining just completely sedentary. So moving your body is a lot difficult if you have a spinal cord injury, or if you don't have a spinal cord injury. It's a lot harder to move a lot of weight than it is to move a normal sized body. So that's a rule for everybody. The other thing about obesity is, again, looking at that skin, and again, adipose tissue or fat does not allow for the dispersion of weight. It concentrates weight in that particular area. So people who are heavier have a higher risk, or people who are underweight also have a higher risk for developing pressure sores. Now, if you think about your time in the rehab center, you got a specialized cushion. That cushion disperses weight across when you're sitting, across your sitting bones and across your backbones, across your sacrum, so that those pointy bones are not drilling down into your skin and creating a pressure ulcer. The same thing happens if you decide not to use the specialty cushion, but there's a pillow. I think I'll use that pillow. Well, that pillow is not going to disperse the pressure across the area. It's going to concentrate it right underneath those bones. It's just going to make a lock right where those bones are. It's cushiony, but it's going to hold the pressure right there. It's not going to spread it out over a wide area. Same thing happens with fat. It just doesn't spread that pressure out. So when you have a lot of fat between your bones and your skin, you're really drilling a hole with those bones, those pointy bones down through your fat into your skin. The other thing about carrying extra weight on your body is certainly the higher chance for rashes and infection. We all know that if you get a rash or infection, that air will help clean up a rash, so to speak. So if you think about what most people are familiar with, a baby and their diaper rash, if you leave that open to air, that bacteria or fungus that is causing that rash is going to dry out. Now, we can't all run around without our clothes on, so naturally we are going to keep our clothes on at all times. So anytime you get kind of a rash in the folds of your skin, either because the skin is touching others, like touching other skin, so the air is not circulating in there, so bacteria tends to grow in there. If you're damp, you come out of the shower and you don't dry those folds of your skin very carefully, that moisture in there is going to help develop bacteria and fungus also in there. So those are just some of the things that can happen with obesity. If you have a spinal cord injury or not, people who have skin folds due to fat are more prone to having rashes in those skin folds, and they can be quite difficult to clear up. So it's nice just not to have that to begin with. Now, sometimes people develop obesity from a lack of mobility. They've followed a good, sensible diet, but they just don't have the muscle tone to kind of hold it all together there, and they might develop a little skin fold. So be sure and keep that area clean. Be sure and keep that area dry. If you have, if you're doing a catheterization, or you have an indwelling catheter through your urethra into the bladder, and you have a lot of skin folds, bacteria is going to grow and proliferate. Fungus are going to grow and proliferate where it's warm, dark, and moist. So if you have an internal dwelling catheter, especially if you're a female and you have a lot of skin around your thighs and that catheter is there, it's warm, dark, and moist. This is why so many people develop a pressure sore on their sacrum, because the rectum, the buttocks has two folds that's divided by that gluteal cleft, and it's warm, dark, and moist in there. You've got the sacral end of the sacrum with that bony prominence sticking out, and that's why so many people develop sore there, not only because of the bone there, but also because of the warm, adult moisture. So people can also get bacteria growth in other skin folds, either around their abdomen. Sometimes you'll see people who have a rash behind their knees, and that fold behind their knees. Certainly people can get rashes, athlete's foot type of rashes, when their feet are damp and they're put into shoes, or if your feet get wet, or if your clothes get wet. Underarms is another spot. You see sometimes kids will get a rash under their neck and the folds of their neck, and people can get rashes there also. And then women, if they can get rashes under their breasts, and men too, if they develop a skin fold underneath their breasts. So it can happen. You see it mostly in women, but it can happen to men also. Another thing to think about with the pressure dispersion is if you are using a pillow and you don't have good head movement, it's a good idea to get a pressure reduction pillow. They're available at the same place where you get pressure reduction cushions and bed surfaces, but also think about getting a pressure reduction pillow, as you can get a pressure ulcer on the very back of your head, back where your skull changes over to your spinal cord. There's a little bump right there at the back of your head, or right there on the round back of your head, or when you're laying on a pillow, your ears can get pressure sore. So it's a good idea to get pressure reduction pillow for when you're in bed, so that you don't develop any problems there. I have a pediatric patient right now. Well, she's 12 now, so she's getting to be adult size, but she has this very, very little tiny but chronic pressure ulcer right on the outer rim of her ear, and it just comes from laying. She tends to lay on one side, and so even if you position her on other sides, you go back and she's fine. She's flipped back into that area. And so we've had really good luck with a pressure reduction pillow for that ear. Of course, the only way to get rid of a pressure sore is to keep off of it, and so we're being hypervigilant about that. But she is at home, and she has home health nurses, so we are being very careful about getting that pressure off that ear, and so she is having some success there. Very slow. You do need to have, if you have a pressure ulcer, you do need to alter your diet a little bit. And when I say alter your diet, people automatically jump right into overeating, because they think, oh, I have to add this to my diet, and so they suddenly add a ton of whatever to their diet. And that really actually brings us up to the next question, is what type of food is needed to assist in healing wounds. And so generally what people need is they need to sustain a good, healthy diet. So they need to eat from all the food groups, but they need to add a little bit more protein to help heal those wounds. And again, you might want to talk to your healthcare professional. You might want to ask for a nutrition consult. Most insurances allow a nutrition consult so many times like every year or every couple of years. So if you have that benefit, it's always a good idea to talk with a nutritionist about what you can do if you have food likes or dislikes, how you can change your diet to accommodate your personal preferences and needs. Now, this is all leading up to wound healing. But I find that when you tell people to alter their diet, they tend to go overboard. So you want to alter your diet with healing pressure wounds, but not just go overboard with all of this. So I think about women who are pregnant, and they say, "Oh, I'm eating for two," and they start gaining all this weight. Well, you're eating for two, but your second little person in there is very, very tiny. It's not like you're suddenly eating for two adult-sized humans. And that is why I think so many people gain so much weight in their pregnancy, is because they think they're eating for two. Well, you're not eating for two human people. Even at the end of pregnancy, about 350 calories is all that needs to be added to the diet. That is not very much. 350 calories would be like a candy bar. Now, that would not be good nutrition, but just for people to get a sense in their diet would be like adding a candy bar to your diet. So not a lot of food. It's not a lot of calories. It could be a lot of food if it's like all, if you're adding vegetables or whatever, but it's not a lot of calories you're adding. So the same thing with healing wounds. Now, there are formulas that healthcare professionals will use for indicating how much protein should be added depending on the level of the stage of the wound. So stage 1 pressure ulcers, you really need to just pay attention to a healthier diet, add a tiny little bit of protein, and by that, a couple of extra bites. Stage 2, a little bit more, and then stage 3 and 4, you might need to add an even more amount of protein. But we're not talking about adding a full steak to your diet. We're talking about just adding a few extra bits. People can also look at these protein shakes that are available now. If you're a non-meat person, but maybe you would like to increase your protein for wound healing, be sure and check with your healthcare professional, because you don't want to add so much of protein or so much of any other kind of supplement that affects other parts of your body. So foods that are protein-based are generally the meats, but also what they call legumes or beans. Those have a tremendous amount of protein. So if you're a person that prefers not to eat meat, you can certainly get meat through a variety of sources. Eggs have a lot of meat, but if you're getting away from animal-based foods, there's foods like tofu. There are grains that have some protein content to it. So there's just all kinds of foods, especially when you get out into the bean category, you're talking about adding a lot of protein. So these are some things just to think about. If you decide that you want to be on a different type of diet, if you decide that you are a vegetarian or if you're a vegan, be sure and talk to a trained professional who has a good understanding of what those diets are to help you get set up in your diet. There's a lot of information out there. Much like the people who are advising individuals to take dietary supplements and vitamins that are self-trained that maybe don't have all the information about a vegetarian or vegan type of diet. So be sure and talk with a trained professional that can get you started on the right track in those kind of diets, because that's going to be very important for you to maintain a good, healthy diet. And you certainly can, being a vegetarian or a vegan, even if you have a pressure sore and you need to add protein, there are all kinds of ways that you can help yourself through your diet, even if you have special dietary needs. The next question is that this person's dietitian has suggested that they stay under 1,000 calories to manage their weight. And this is a young person and an athlete. So they used to be an athlete. So and I think once you're an athlete, you're probably always an athlete. But I understand maybe some mobility limitations keep you from doing the same type of athletic workout that you did before. However, anybody, even people with spinal cord injury, can use some of those techniques I've talked about for doing exercise. So if the dietitian has suggested that calorie level for you, it's a good idea. 1,000 calories a day is most typical for maintaining human function. Some people will say you need 1,200 calories a day, so maybe there's some weight loss or some management of muscle loss that needs to be going on here in this. But if your dietitian is a trained professional and they're suggesting this to you, that's a good idea to follow it. Going too low in calories is not going to help you maintain a weight loss program. 1,000 calories a day is if this dietitian has suggested it for this person, that's certainly something to follow. But if you go too low in your calories, what's going to happen is, yes, you're going to lose weight, but you're also going to lose a lot of the nutrition because your body's going to take the nutrition and send it to your brain and your heart to try to keep that and kind of forget about sending that nutrition way out into the further parts, the further reaches of your body to get optimum nutrition to your toes and your fingers and your body parts. So when a person goes with too low of a calorie count, their body starts to harbor and hold on to the calories that they're getting as opposed to losing weight. So you can take your dietary calorie count thinking you're going to lose weight too low and actually slow down the calorie burning process because your body's going to want to hold on to that. Okay, so we have another question about osteoporosis and what foods will help. And certainly when we think of osteoporosis, we think of anything that has calcium in it. So any foods that have calcium, certainly we tend to go to the dairy products for that. However, sometimes people who have spinal cord injury or people in general that take too much calcium can develop kidney stones or calculi in their bladder, which can obstruct urine from coming out even when you're doing catheterization because they won't pass through the catheter eye sometimes. So you want to, again, when you think about adding calcium, you don't want to go out and just start taking in as much calcium as possible. You only need to add a bit of calcium to your diet. If you decide you need a calcium supplement, or if your healthcare professional tells you you need a calcium supplement and they are monitoring that, by all means go ahead and do that. Just don't start out, I think I'll just go out and get some of these calcium tablets and just start eating them because the more I put in, the better it's going to be. Well, calcium is one of the major electrolytes in the body. So if you get too much or too little calcium in your body, you can have some side effects that are not very pleasant. It can lead to heart complications and just general body function complications. So again, adding, if you want to add, maybe you want to add an extra half a cup of milk, or maybe you want to add an extra piece of cheese to your dietary. Those kind of things are probably not going to accept most people's calcium balance. However, you really need to talk with a healthcare professional about how much. I do see people that put themselves on medications because they've seen it on TV, they've talked to someone, they've heard about something, and a lot of people do this. They have no problems, but many, many people end up with problems. So there can be a problem with taking too much calcium, so you really want somebody to direct how much you should be having because you really want to avoid any kind of stone formation or any kind of electrolyte balance in their body. Something I've written about in the blog, and I really want to highlight about, just arbitrarily taking vitamins and supplements. A lot of people I see have put themselves on aspirin because they know that this affects heart health and it can make your heart healthier, which is all true. But without having anybody kind of monitoring that, it can be very dangerous. So sometimes people, they'll put themselves on an aspirin, so they think, oh, okay, I'm going to put myself on an aspirin, and they don't realize the aspirin strength that you need to take is baby aspirin size, the 81 milligram size aspirin, not the 325 size aspirin. So not too long ago I had a patient self-medicated, took an aspirin a day, took the 325, and then ended up with a huge GI bleed. So their stomach and their bowel was bleeding. They had ulcers in there from where these aspirins were just sitting in their stomach. Now, that's not to be confused with if you're having a heart attack, you take an aspirin right away to cut down the effects of that. That's a one-time thing only if you're having a heart attack, so that's a different thing altogether. But anytime you try to self-medicate, especially if you have a complicated medical history or if you're taking medications for a particular illness or injury, it's just a good idea to check with your pharmacist. They usually keep a list of your medication. Most pharmacies you can go in and you can say, I'm adding this, or if you get a prescription from your physician, they'll look in their computer and they'll say, oh, that is contraindicated with this other medication. So it's just a good idea to double check, make sure that somebody is really watching and monitoring that for you. The other question about the osteoporosis, would exercising on a stationary bike help? That certainly does, and the reason is probably more complex than what you were thinking. It exercises the muscles, and as the muscles are exercised, they pull on the bones. That's what makes your bones strong, is the muscles when they turn into tendons, and the tendons attach to the bones. So when you're using your muscles, those muscles pull on the bones. That's why even doing passive range of motion, you're stretching those muscles and you're pulling on the bones. Passive might not be enough for somebody who has osteoporosis. In fact, it probably wouldn't be. You would need to do some kind of therapy or take that calcium supplement as per your physician choice. So we have a few other questions, but our time is up. There's a great question about my eyes are falling on it here. Somebody using Raisin Bran has been helpful. That probably is very helpful to regulating the bowels because it's bran, number one, and we know that bran is fiber, so that's great. And also raisins have a lot of fiber in them. They also have a lot of potassium in them, so it can be good for a couple of different reasons. And then let's see. What foods help with rheumatoid arthritis? And there are foods that are supposed to help with arthritis. I'm not that familiar with what all of those are, so I would refer you to your individual nutritionist or your healthcare professional who should be able to help with that specifically for you. But that should be a good start. That's a good place to start. And so we are at the top of the hour. It's been wonderful chatting with you. It's a great day. This topic always has a lot of things that people are interested in. So it's just been a really fine day. And I thank you and look forward to seeing you on the blog.
Yes, thank you everybody for joining us today. Thank you, Linda. And the next Nurse Linda webcast will be at the end of December, so please go to christopherreeve.org to sign up for the next one or wait for your email to hit your inbox. Thanks everybody for joining us today. Have a good rest of your day.
Thank you.
This does conclude today's webinar. You may now disconnect your line.